Thank you to the Society for allowing us the opportunity to present our research. These are our disclosures. Achalasia is a chronic disease characterized by the inability of the lower esophageal sphincter to relax and the dismodal esophagus. Traditionally, Heller myotomy, which involves surgical disruption of the lower esophageal sphincter, has been the gold standard treatment. Our group has previously shown that as time progresses, patients will frequently develop recurrent symptoms that require intervention. Treatment options for symptomatic recurrence include pneumatic dilatation, which do not provide long-term symptomatic relief, redo Heller myotomy, which may provide better symptom relief, but is technically complex, especially after previous Heller myotomy, and may also require an open approach. Since the advent of peroral endoscopic myotomy, several groups have shown that POEM is effective in treating patients with recurrent symptoms after Heller myotomy. However, these results only show short-term benefit. Therefore, our objective was to determine the safety and long-term efficacy of POEM after Heller myotomy. Our outcomes included objective measures such as timed barium esophagram and high-resolution manometry, as well as longitudinally reported patient outcomes. From 2014 to 2019, 218 patients underwent POEM at our institution, 40 of whom had previous Heller myotomy. Wilcoxon-signed rank test was used to compare timed barium and high-resolution manometry measures before POEM and after POEM. Longitudinal local regression was used to measure the degree of patient-reported symptoms over time, and a Kaplan-Meier curve was used to measure the degree of freedom from recurrence, which was defined as an Eckert score greater than 3. The cohort median age was 53.5 years, 60% were male, and 86% of patients had a previous laparoscopic approach, and 2 had a previous thoracic approach. 30 patients had previous door fundoplications, and the median Eckert score before POEM was 8. The median time from Heller myotomy to POEM was 5 years. Roughly 90% of the cohort had type 2 and type 1 achalasia. Median operative time was 99 minutes. 45% of the patients underwent a posterior mucosotomy with a median submucosal tunnel length of 12 centimeters and a median total myotomy length of 9 centimeters. The median length of stay was 1 day. 3 patients were readmitted, and 3 patients had mucosal perforations that were clipped endoscopically and did not require additional procedures. It was likely that their previous fundoplications were protective in this setting. These 2 box plots show the timed barium esophagram width before POEM and 2 months after POEM. The column width at 1 minute decreased from 3.5 centimeters before POEM to 2.5 centimeters after POEM. The median width at 5 minutes decreased from 3.3 centimeters before POEM to 2 centimeters after POEM. These 2 box plots show the integrated relaxation pressure, or IRP, before POEM and 2 months after POEM. The median IRP decreased from 19 millimeters of mercury before POEM to 6.4 millimeters of mercury after. This is a local regression, and it shows the degree of symptomology for the cohort over time. 34 patients had at least 1 year of symptom follow-up, 24 patients had at least 2 years of symptom follow-up, and 10 patients had at least 3 years worth of symptom follow-up. Patients experienced a sharp drop in symptom severity within the first 3 months, and this symptomatic improvement persisted even out to 3 years as the overall cohort symptomology hovers below 3. Shown here is the Kaplan-Meier curve depicting the symptomatic recurrence, and all patients were symptom-free at 1 year, and only 12% had symptom recurrence at 3 years after POEM following Heller. In summary, POEM after Heller myotomy provides objective improvement in esophageal drainage with low morbidity, and patients continue to have symptomatic improvement even out to 3 years after POEM following Heller myotomy. POEM not only provides short-term benefit, but also provides long-term benefit after Heller myotomy, and is a safe and durable option for palliation of achalasia symptoms after Heller myotomy. Thank you.